hair transplant dosing.
Good evening to each and everyone over here. I'm thrilled to welcome you all for today's informative webinar on aesthetic dermatology. I am Gagana Bellari, manager at Mediversal Academy, and I am excited to introduce our speaker, Dr. Uday Sonnapa. With over 8 years in dermatology, cosmetology, and hair transplant surgery, Dr. Sonnappa is a consultant at Narayana Hrudayalaya and Wellness Champion Hospital in Bangalore. As the director of Dr. Uday's Advanced Skin and Hair Clinic, he has made significant contributions to dermatology. Dr. Sonnappa's expertise includes dermatosurgery, acne surgery, vitiligo surgery, lasers, and aesthetics dermatology, hair transplantation, pediatric and geriatric dermatology, and sexually transmitted diseases. He completed his MBBS in 2015 from NTR University, Andhra, and MD in Dermatology in 2018 from Rajiv Gandhi University of Health Sciences, Bangalore. In 2019, he furthered his skills with a dermatosurgery fellowship from St. John's Medical College, Bangalore. Dr. Uday Sonnappa brings a wealth of knowledge to our webinar, sharing insights on aesthetic dermatology. Join me in welcoming Dr. Sonnappa. Thank you. Over to you, Dr. Uday Sonnappa.
Doctor, please, you can unmute yourself now.
Hello.
Yes, you're audible.
Thank you so much, Ravina, for that brief introduction. Yeah, a very good evening to all of you all. Today we'll be talking about aesthetic dermatology. I'm very sure most of you all are keen about this topic, and this is something that we see on a day-to-day basis. So today's class will be a crisp, brisk introduction to aesthetic dermatology. I've tried to combine all of those popular procedures which are done on a day-to-day basis from a dermatologist alone, right? So to begin with, today's learning objectives include to enumerate common cosmetic problems presenting to the dermatologist, elaborate on common procedures in cosmetic dermatology practice, including the use of chemical peels, microneedling, platelet-rich plasma, botulinum toxin, thermal fillers, understand the basic principles and mechanisms of lasers and light devices, describe in brief the common lasers used in dermatological practice. Dermatology has been a blend of clinical dermatology and cosmetic dermatology. I'd like to open my session with this topic because there's no cosmetology without a forethought of what the problem is. Only when you know the depth and in complete knowledge of the problem, you'll be able to give diverse modalities of treatment. So it's important you understand the basics. In-depth knowledge of clinical dermatology is a must so as to understand and correct cosmetic imperfections encountered due to pathological and psychological changes in the skin. Common cosmetic problems are listed on this table, which present to a dermatologist or anybody on a day-to-day problem. We've divided into skin, hair, and nails. Of skin, we have acne and acne scars, melasma, tanning, facial melanosis, periorbital pigmentation, as in pigmentation around the eyes, dull, oily face, open pores, hirsutism, as in male-like pattern hair in women. As signs of aging, we have wrinkles, tear troughs, sagging face, and unwanted tattoos as well. Cosmetic problems of scalp hair include androgenetic alopecia, telogen effluvium, and dandruff. Of the nails, we have dull, brittle, lusterless nails, discolored, thickened nails. Aesthetic procedures are broadly divided into which are non-laser and which are laser and light techniques. Under the non-laser, non-light based techniques include chemical peeling, microdermabrasion, microneedling, platelet-rich plasma, botulinum toxin injection, dermal fillers, mesotherapy, threads. Under laser, we have commonly, most of you all know, laser hair reduction, vascular laser, scar and resurfacing laser, pigmentary disorder lasers, intense pulse light, and radiofrequency. Before any procedure, a thorough clinical evaluation should be done on the patient's demography. Also, to know whether patient's allergic to any sort of medicine or has a predisposing condition. Also, it's very important to understand the history of keloid or herpes simplex infection, which could be triggered because of the procedure. Patient also should be counseled beforehand about the procedure and all the other possibilities and also the outcomes of the procedure so as to have a realistic goals that can be achieved. And mind you all that a single procedure cannot address all the problems. It is usually a combination of multiple procedures which required for cosmetic correction and to fulfill patient's desired expectation. Aesthetic procedures are usually techniques and technologies that are of non-invasive or minimal invasive procedures. To begin with, chemical peeling. It's the application of chemical agents to the skin which creates controlled epidermal destruction and dermal inflammation, which leads to exfoliation and regeneration of new epidermis. This word says, so basically a chemical agent when it's applied on the skin. So as we all know, skin has got three layers, epidermis, dermis, and the deeper dermis, subcutaneous fat. So this epidermal layer is tried to concentrated on and there is a slight erosion of it. So giving you a new skin, NEO, not NEW. So this skin is where we are targeting and this is what gives the color and the results that we desire for. So the procedure usually includes priming of the skin prior to the surgery with sunscreen and other skin lightening agent at least 2 to 4 weeks. By priming, we mean preparation of the skin before we go in for chemical peeling. So ideally, any patient who walks into your OPD with skin lightening or asking for chemical peel, do not start beforehand. You'll assess the patient's skin quality, start them on some skin lightening agent, and then call them after 4 weeks to start the procedure. Also, one more point to remember, before you start the chemical peel, stop all your skin lightening agent at least 48 hours prior to it. A thin layer of the peeling agent is applied evenly on the treatment area using a peeling brush or earbud. Patient is looked for endpoint like frosting, a similar event that happens when we are driving a car on a winter evening and how the windshield covers with smog. The same kind of a texture is seen on the skin when the peel is applied. That is your endpoint. A peel has to be neutralized, and it is done either with normal saline or quite commonly used 10 to 15% sodium bicarbonate solution. Post-procedure care includes mainly sun protection and moisturize strictly. Also, the other takeaway points or talk to patient points are: one, ask the patient not to scrub or rub the face for a period of 1 week. Avoid using of any harsh soaps or solvents on the face, considering it acts as an irritant. Ideally, chemical peels are done at 4 to 6 weeks apart. So this is a typical picture where you hold the peel in the glass bowl and use a brush with wide mouth and try to paint outward to inwards. That is from the center to away so that it doesn't drip. The other point to note also, the patient's head is elevated. So the head end of the patient should be maintained at a 45-degree, and mind you all again, not to lie flat for the reason, let's say the peel overflows, as in the solution, it shouldn't deposit anywhere around the sensitive areas. Hence the reason of propped up position. So this is just to show you all the different layers of skin and how these act. So ideally, we've got superficial, medium depth, and deep depth peels. So the superficial acts only up to the epidermis. The medium depth, it acts from the epidermis to the dermis, and the deep peels acts from the dermis to the deeper dermis, that is just above the fat layer. So the commonly available peels and their various depths are given in the flow chart. And for most of us, very superficial peels include 10 to 50% glycolic acids and salicylic acid, Jessner's solution, and retinoid. These are quite commonly used in active acne, post-acne pigmented macules, post-inflammatory hyperpigmentation, or periorbital rejuvenation. The superficial peel, which causes necrosis of full thickness of the epidermis, these include 10 to 20% trichloroacetic acid, 20 to 50% glycolic acid, Jessner's solution, malic acid, and lactic acid. Quite commonly, they are used in cases of facial melanosis, fine lines, melasma. Medium depth peel, which causes necrosis up to the papillary dermis. So these include 35% trichloric acid, 50 to 70% glycolic acid, 40 to 70% pyruvic acid. Quite commonly in deep acne scars, photopigmentation, facial rejuvenation, wrinkles. Deep peels which end up causing necrosis up to the reticular dermis. Therefore, 50% trichloric acid or 88% phenol. These are recommended in case of deep wrinkles. Just to go back to the photo earlier, so now if you all see, now when I said the earlier table and now when you try to associate with the photograph, now you'll understand what is epidermis. The green part talks of the epidermis, the green arrow. The blue arrow talks about the upper dermis. So it is touching up till the papillary dermis only. And below that, whatever goes low, the darker blue or the deep sea blue, that talks about the deep layer, which targets all the layers of dermis. So benefits of chemical peel, quite commonly we've already said, on a larger spectrum, this is what people use on a day-to-day basis, which treats acne, kills pre-cancerous skin cells, fades pigments, rebuilds the collagen, repairs skin barrier, and also helps in removal of smooth scars. So this is a photograph of a woman who was presented with melasma. Photograph A talks about the pre-treatment and photograph B talks about the one session after peel. And this is a case of acne again, where the patient is a case of inflammatory acne and how she has responded to salicylic acid before and after. So there are adverse effects expected when caution is not exercised. So quite commonly, post-inflammatory hyperpigmentation or hypopigmentation is seen. Allergic reactions are seen. Milia is seen. Lines of demarcation become prominent. Persistent erythema is seen, or secondary bacterial or viral infection do occur. So very similar to chemical peel, but a slight modification where a machine is used for the process. It is also known as skin polishing. It is a method of skin resurfacing involving mechanical exfoliation of upper layers of the dermis. This causes regeneration of epidermis and dermal edema and subsequent collagen remodeling. With MDA, there is a change in epidermal barrier function. Hence, it can be used for transdermal delivery of cosmeceuticals. The usual indications for microdermabrasion includes facial rejuvenation for acne scars, dull skin in case of tanning, facial dyschromias, that is more than two different colors present like blue and black, completely brown, bluish for these conditions also, in combination with peels to increase their penetration. In MDA machine, aluminum oxide crystals are used, which are released under pressure and then vacuumed off. Or there is also a diamond tip and a handpiece that can be used to abrade the skin. Handpiece is held perpendicular to the surface of the skin and moved parallel to the tension lines of the face. These tension lines, just to bring to your notice, so how the globe has longitudes and latitudes, there are similar imaginary lines on the face. So it is ideal for us to pass through those lines in that direction so as to not cause any further damage. One can begin from the forehead, medial to lateral with uniform pressure and then proceed to treat the cheeks, chin, nose areas. Post-procedure care includes photoprotection, avoidance of retinoids, which can cause skin irritation. Adverse effects, pretty much like chemical peel, there is erythema, dryness, post-inflammatory hyperpigmentation, increased skin sensitivity, or somebody who's had a case of allergy can also have urticaria. This is typically how you use. So if you all see the cut section, anatomical cut section over the photograph, so one shows the disorganized layers present. But post MDA, this is a diamond tip probe that the person's holding onto the nose. The skin smoothens after that. So basically, MDA provides a non-surgical skin resurfacing procedure by using microcrystalline diamond heads. With maximum suction of 65 to 68, it can peel dead cells off the surface of the skin and then suck away the particles, dust, and dead skin. This is a quite commonly used diamond dermabrasion. So along with that, there's another section used for it, which causes aluminum oxide crystals. So either through diamond tips or aluminum oxide crystals, you can achieve the same thing. Quite commonly done for whiteheads or blackheads that are commonly spoken in colloquial language. In medical term, comedons. Further, micro needling. This is something that most of you all know already, derma roller. A handheld device dermoroller is used for microneedling. It's a plastic handle and a drum-shaped cylinder at other end, which is studded with rows of sterile needles. Wide range of dermorollers are available based upon the needle length and accordingly used for different indication. Usually for pigmentation around the eye, 0.5 mm is used. For treatment of the face, 0.5 to 1 mm is used. For acne scars, 1 to 1.5 mm is used. For scars following chickenpox, 1 to 1.5 mm. Androgenic alopecia, telogen effluvium, 1.5 mm. Stretch marks, since they are greater in mass, so you need a bigger depth, 1.5 to 2 mm. And deeper scars, 2 mm is needed. So this is how a typical derma roller looks. So it has got a straight handle to hold a drum with 192 sterile needles. So ideally, a single derma roller is used for a maximum of 2 to 3 sessions. And after each session, it is made sure it is sterilized, either kept in Sidex or sent for autoclave. Topical anesthesia cream is applied, either commonly available brands being Prilox or Toplap. A thick layer of this is applied, at least 1 mm thick, applied to the treatment area at least for 30 to 45 minutes. The procedure is performed under aseptic precaution. Derma roller is held like a pen and it is run forth like horizontally, vertically, and oblique direction. Basically, when you take 1 centimeter square area, the same directions are followed through everything. And the end point here is pinpoint bleeding. So the idea here is we are trying to cause neovascularization. So when the blood bleeding happens, hematoma is formed and the scars start filling up. So that gives a idea of fullness. There is a slight modification to microneedling which includes derma pin or microneedle radiofrequency procedures, which radiofrequency procedure I'll talk in detail later. These are more of automated devices where depth of the needle penetration can be adjusted according to the indication. Adverse effects are pretty much the same as the others. So this is how it is held, and patient is same put in proper position and try to cover all the areas and stay away from the sensitive areas. So here the patient, you're seeing bruising around the face, which is created under controlled usage with a derma pen. That is a slight modification to native derma roller. Platelet-rich plasma. This is again a topic not new to many of y'all. So it is an autologous concentrate of plasma with higher count of platelets than whole blood and activation of sodium bicarbonate or sodium chloride. Alpha granules in the platelet degranulate to release multiple growth factors. These factors are useful for regeneration and restoration of human tissue. So here, this is a typical PRP tube where the yellow, slight turbid yellow, is the platelet-rich plasma, and the bottom at the tip is the platelet-poor plasma. So clinical indications, usually for facial and neck rejuvenation. It helps in proliferation of dermal fibroblast and procollagen type 1. Hair regeneration, it acts on the stem cells of hair follicle, stimulating development of new follicles and neovascularization. In signs of aging, fine lines and wrinkles, augmentation of soft tissue, thereby correcting overlining rhytides. In cases of chronic ulcer also it is used. Either it is sprayed or injected where it causes release of platelet-derived growth factors, vascular endothelial growth factors. The procedure includes 15 to 20 ml of blood is collected from cubital vein of the patient. It is subjected to a double spin through centrifuge where PRP is separated from the red blood cells. After activation, PRP is injected immediately with insulin syringe for facial rejuvenation and scalp hair growth. It is injected 1 to 2 centimeter apart, 1 ml at each site. PRP can be used for chronic ulcer, either be injected or sprayed on the ulcer bed. Chronic ulcer promote healing by releasing platelet-derived growth factor, vascular endothelial growth factor. Adverse effects, it is quite commonly a very safe procedure. Unless aseptic norms are not followed, then you might encounter bacterial infection. So a pictorial representation of the same where the patient's blood is drawn through a syringe and then transferred to a citrate tube. That citrate tube is balanced on the centrifuge and run at two spins. One is the hard spin and the soft spin. So what you get is your platelet-rich plasma, which usually the plasma contains 55% of whole blood, least dense component, and there's between the yellow and the red, the white part, that is called the buffy coat, And later, the platelet area where there is leukocytes and platelets, less than 1% whole blood is there, which also has got 45% of whole blood, most dense component, which is then injected. So this is a typical presentation of photograph where a patient underwent platelet-rich plasma. This is end result after 4 sessions. So first you can see patient is on grade 6 to 7 of balding. Here you can see he's reduced to grade 4. That is only pocket of hair which is left or thinning present only in the crown area. So now again, botulinum toxin, which is for most dermatologists bread and butter and quite popularly practiced by everybody. So it is produced by a bacteria called Clostridium botulinum bacterium. There are 7 serotypes of which A and B are commercially used. The chief mechanism includes inhibition of release of acetylcholine at the neuromuscular junction, thereby causing muscle paralysis. Relaxation of the muscles reduce the wrinkles and give youthful appearance. The effect of botulinum toxin is temporary. And quite commonly, when everybody talks about Botox therapy, Botox is a brand name, right? It is promoted by a company called Allergan. So the ideal name is botulinum toxin. So indications include for forehead lines, the muscle that is targeted is frontalis. For glabellar or frown lines, the muscles that are targeted are procerus, corrugator, supercilii. Or for crow's feet, that is along the eyes, orbicularis oculi. Bunny lines or nasal scrunch lines, these are transverse nasalis along the nose. Perioral rhytides or smoker's lines, this is along the mouth, orbicularis oris. Gummy smile, levator labii superioris, eloquinacea. And for neck, it is the platysma. So the procedure usually includes, it comes as a dry powder in a while and hardly visible, right? It is just like a peck. So it is to be a cold storage has to be maintained. There are others in the market which do not need also, but most come as cold storage units only. It is reconstituted with normal saline at 2.5 ml per 100 unit. After reconstitution, the potency of it lasts for good 6 weeks. Based on the indication, the number of units of botulinum toxin required are determined. Topical anesthesia is applied and botulinum toxin is injected into the target muscle. The onset of action usually takes or starts after 12 to 72 hours and lasts for 4 to 6 months. The adverse effects is only when the drug is not delivered properly, that is over counting the medicine leads to paralysis of unwanted muscle. Commonly noted are ptosis of the eyelid, brow-ptosis, mask-like face, cheek, diplopia, strabismus, bruising, and ecchymosis. So this is one pictorial representation telling where the Botox lines is given and how many units are given. Usually for the frown lines, about 10 to 30 units is given. For the forehead, we give it in a line, so about 8 to 20 units. For the crow's feet, that is along the eyes, usually 10 to 15 units. Gummy smile are usually given about 2 to 4 units. Lip flip, ideally people prefer a filler over a Botox, but based on one's individual expertise, you can try to cause lip eversion through Botox also. So a very minute 4 to 8 units is given. Marionette line, that is along the jowls, so about 2 to 6 units are given. Neck lines, which is quite commonly in elderly, where you have sagging, about 25 to 50 units are given. Masseters, masseters also hold medical benefit, as in people who have got clenched teeth or deformity with the jawline. In them also it's given. So it's given close to 15 to 50 units. Dimpling chin, about 4 to 8 units. Bunny lines, about 4 to 8 units again. So these are the commonly available brands in the market. So Botulox is a Chinese-based company. You have Nabota, Botox, Sartorium, and Meditoxin, all of the others in the market. So this is a case of a patient who's got crow feet, that is lines along the lateral canthi of eye, and immediately after Botox injection, the patient responded well. So talking about dermal fillers, in practice, dermal fillers are supposed to be more costlier, but people prefer this widely for the reason any mistake done can be reconnected. But whereas in Botox, it cannot be undone. The effects usually last for 1 to 18 months, 1 year to 18 months. Dermal fillers also pretty much based on the brand, it lasts somewhere between 2 years to 2.5 years. Is the choice of treatment for aging phase where there is literally volume loss. Ideal filler is one which is non-toxic, non-mutagenic, hypoallergic, and malleable. Fillers are used for facial rejuvenation and scars. So usually we have temporary, semi-permanent, and permanent. Temporary include hyaluronic acid, collagen, alginates. Semi-permanent include calcium hydroxyapatite, polylactic acid, polymethyl alkylate. So there are different brands of fillers and what one needs usually. For smooth brows, crow's feet and brown lines, usually Botox are better. For smooth under eyes and teardrops, fillers are better with fat injections. For lift, that is for you to have that counter on the cheek. Lift, you need fillers again, either Voluma or Restylane or lift. Smooth marionette lights, you need Juvederm or Refine or Restylane or Define. Plump with lips, that is giving volume to the lips, Juvederm or Ultra Volbella are recommended. To rejuvenate hands, as in where there is volume loss and sagging, again, Radiance or fat injections are preferred. For soft nasolabial folds, for at least 12 months, Juvederm or Restylane are needed. Or for smooth and vertical lip lines, so you need Restylane Silk or Volbella. Smooth chin wrinkles, you use Juvederm. And to fill acne scars, Juvederm, Bellafill, or Radiance is required. These are different brands that are available in the market. So the ideal indication for fillers, like we have discussed earlier, when there is forehead hollowness or temple hollows, that is on the sides, teardrop, when we've got sunken eyes, nasolabial folds when they become very obvious, chick when they've got a lot of sagging, when the jaw lines are very round, people want a good definition, then it is done, or lip augmentations also it is done. So hyaluronic acid is the most commonly used filler. Pre-filled syringe with cannula or needle are available, and filler is injected in lower dermis or subcutaneous plane. Injection techniques include serial puncture, linear threading, depot bolus, fan technique. Ischemic complications can occur due to intravascular injection of fillers. Facial asymmetry producing hematoma and facial edema can occur. So this is one picture. This is how the box looks, and this is a filler. So at the tip of it, you can either use a needle for direct depot or you use a cannula. For anybody beginning their practice with fillers, it's always ideal to use a cannula rather than a syringe to avoid any trauma to the anatomical structure. The worst fear is your bleeding or puncture of your vessels. So usually this is a clear photograph showing before and after effects with and without fillers. So it corrects the sleep wrinkles, cheek enhancement, tear troughs, nose correction, lip lines, lip augmentation, and chin augmentation, that is giving a definition. So these are quite commonly available brands in the market. Juvederm and Restylane are quite commonly or popularly used. Mesotherapy is a technique which involves micro injections of medicinal preparations like vitamins, minerals, bioactive substances in the dermis or subcutaneous to promote healing or corrective treatment to a specific area of the body. These usually include cellulite, local fat deposits like double chin, in treatment of lipomas, alopecia, pigmentation, and skin rejuvenation. So it is usually targeted at reducing the fine lines and wrinkles, improve acne scars, minimize the pore size, improve skin texture and the tone. For most of the dermal procedure, a topical anesthesia is applied and the meso solutions are injected either with meso gun or meso needles. Meso gun is a syringe infusion pump that is capable of injecting desired substance at required quantity and depth. Commonly used meso solutions include phosphatidylcholine for cellulite and fat deposits, also for lipomas, biotin, amino acids, and minoxidil for alopecia, vitamin C, kojic acids for pigmentation, hyaluronic acid for skin rejuvenation. The adverse effects usually are bruising, pain and secondary infections may occur. Skin necrosis can occur if phosphatidylcholine injections are given in superficial planes. So this is a photograph of a meso gun. So this is the process involving, and it is given usually of in cases of wrinkles, for skin whitening, serum penetration, hair growth, vampire facial, or for PRP of hair or skin. So this is how at a closer view, how it's given. So the gun consists of a needle. So the depth is pre-recorded and the drug delivery also happens at a pre-recorded time. Threads, these are again a popular modality in market right now for signs of aging or facial rejuvenation. So they are non-surgical facelift, which corrects sagging of face. These are absorbable, flexible, and non-antigenic with low inflammatory response. They are placed in the subcutaneous plate. This causes collagen and fibroblast production, which helps in skin tightening and scar resurfacing. So ideally, the threads are indicated for brow, mid-face, jawline, and neck. So the photograph shows at how they are placed and how it is pulled. So the procedure includes topical anesthesia and the threads can be inserted by various techniques. So it's either straight, waveform, zigzag, or crisscross. There are mono threads, twin thread, mono screw, cog hook threads are available for cosmetic use. Polydioxinone filaments is a synthetic absorbable suture material, modified and most commonly used for skin tightening and resurfacing. Adverse effects include at the site of introduction. So it's either hematoma, bruising, most common complications. There could be infection, edema, trauma to internal structures or improper correction may occur. So the types of threads for facelift, like earlier said, the green uh, needle talks about monolinear threads, which is quite commonly used, or spiral threads, dual thread, which are barbed within themselves, double threaded, where there are two sets of double threads along them, mono gold thread, duplex thread, and cork thread. So this is a PDO thread, and the photograph represents the direction in which the needles. I want you all to trace the dot and the arrow going. So in that direction, the threads are introduced so that there's a lift and tightening of the skin. And this is in situ presentation in the packet, how the threads look. The needle has a thread within it. So once you push the needle, the thread is held back and then you pull back the needle. Tropedio thread lifts indication include tension lines, glabella of frown lines, brow lift from infraorbital wrinkles, crow's feet, jawline lift, nasolabial folds, smoker's lines, marionette lines, neck and submental rejuvenation. So the first photograph here talks about the facelift. So from the dot, it is traced above. So and then tied up at the temple region. So to give you that pull and tightness. And the second photograph talks about augmenting the cheeks. So there are crisscross threads that go. And the third photograph talks about neck rejuvenation where multiple PDO threads are inserted. So if you'll see on the fourth, this thing, close to the thumb, there is the hub of the needle with white things on it. The white thing prevents the thread from coming back. Once the needle is introduced completely into the skin, the white nodules or beads stay in contact with the skin. They are held upon the skin and the needle is pulled back. So ensuring the thread stays in the subcutaneous plane. So these are monothreads again on the lower photograph where you see the threads spouting out. No, so patient is not left like that. A knot is tied and it is cut very close to the skin and left. These are for non-surgical way of lifting the face and also defining the jawline. So now talking about laser and light devices. Laser stands for light amplification by stimulated emission of radiation. A basic knowledge of laser physics and biology is important to understand their clinical applications. The chief properties of laser light, which differentiated from regular light sources, are it is monochromatic, the waves are of a single wavelength, laser light is coherent, waves travel in the same phase and direction, laser light is collimated, waves are parallel and not divergent. The essential components of laser include the energy source, lacing medium, chamber, and delivery system. Lasers are named after the constitutions of the lacing medium, which determines the characteristics of emitted laser light. The lacing medium can be a gas, that is like carbon dioxide laser, liquid like rhodomin dye, or solid state like ND-arc laser. This photograph talks about the various wavelengths of lasers that are available in the market and their in-depth of it. So, so it starts somewhere from 308 nanometer and goes up to 1600 nanometer. So we have eczema laser, argon, krypton, pulse dye laser, ruby, alexandrite, diode, ND-arc laser, erbium glass, thulium laser, erbium YAG, 2940 nanometer, and CO2 fractional laser. So most of these are targeted through specific agents present in the skin. So the eczema laser usually targets the melanocytes or the cells. And if you go up to diode laser or ND-arc, they target the blood vessels and the subcutaneous fat. So likewise, their indications are chosen. So the basic principle of laser is selective photothermolysis, which means selective destruction of a chromophore. Laser energy absorbed by the chromophore is converted into heat energy. This energy then causes destruction of chromophores and desired effect is thus obtained. Based on laser tissue interaction, the type of lasers can be classified as ablative, non-ablative, and fractionated lasers. In aesthetic practice, lasers are chiefly used for hair reduction, vascular lesions, scars, and resurfacing, and in pigmentary disorders. Intense pulse light is a polychromatic, non-coherent light of high intensity delivered in a span of milliseconds using xenon flash lamps. Indication of IPL includes hair reduction, vascular lesions, acne, rosacea, pigmentary disorders, keloid, scars, photorejuvenation. It has a broad wavelength ranging from 380 to 1400 nanometer. Various wavelength filters are provided based on clinical indication. So lasers for hair reductions usually include for hirsutism, hypertrichosis, cosmetic or beard shaping. These include diode laser, long pulse neodymium YAG pulse, long pulse alexandrite laser or ruby laser. They target the hair follicle or melanin. There's one point I want to stress here. We do not have permanent laser hair removal. Whatever's available in the market is only laser hair reduction. right? So when you treat any patient with hirsutism, it is important for you all also to take note of their hormonal imbalance or PCOD background. Treat them medically and with laser, then this process lasts forever. Or else only laser alone, as long as the procedure is done, patient is happy. Once the laser is stopped, the hair does grow back. Laser for vascular lesions in terms of for telangiectasias, hemangiomas, port wine stain or rosacea. Usually we use pulse dye laser, Nd:YAG laser, intense pulse laser, or potassium titanyl phosphate laser. So they usually target the oxyhemoglobin and RBC in the blood vessel. So lasers for scars and resurfacing include carbon dioxide laser, Nd:YAG laser, erbium YAG laser, erbium glass laser. These target water, melanin, oxyhemoglobin. Lasers for pigmentary disorders, usually for tattoos, freckles, melasma, nevus, or photorejuvenation, Q-switch Nd:YAG laser is used. So they target melanin, hemoglobin, collagen, or exogenous tattooing. The treatment area is cleaned, topical anesthesia is applied, and eye protection goggles are provided so as to accidentally laser beam not to hit the eye. Also, at the same time, the physician who's conducting also wears a glass to make sure he is also safe from accidental laser beams. Post-care includes strict sun protection to avoid inflammatory pigmentary changes. Laser and IPL procedures are usually office-based and provide good aesthetic response for various indications. The adverse include pain, purpura, edema, blistering, post-inflammatory hypopigmentation, burns, scarring, bacterial and viral infections. So in laser hair removal, the beam targets the hair follicle. So at the same time, it prevents, it is absorbed by the melanin, absorbs the melanin, absorbs the light and heats up. So thereby causing the tissue destruction and shrinking of the hair bulb. So in on the whole, it delays the rate at which the hair comes back. So various laser instruments that are commonly used in dermatology. So this is a photograph of a patient treated for acne scars before and after treatment with fractional CO2 laser. And this is a case of hirsutism where patient is treated with diode laser. And here a post-traumatic scar, which is treated with fractional CO2 laser. A case of keloid with good response with pulse light and intralesional steroid therapy combination. So a tattoo mark which was present on the forehead with good response to Q-switch Nd:YAG laser. So talking about radio frequencies and other technologies. So radio frequency is a non-invasive anti-aging therapy, which includes radio frequency, which can be used alone or in combination with ultrasound or cryolipolysis. Radio frequency is energy in magnetic spectrum ranging from 300 megahertz to 3 kilohertz. It is used for skin tightening, fat and cellulite reduction. RF energy mediates stimulation of adipocyte metabolism and induces apoptosis. Various aesthetic indications include face, periorbital rejuvenation, neck rejuvenation, fine wrinkles, striae for double chin, body shaping, contouring. Multiple settings are required for optimal results, and few adverse events such as erythema or blistering may occur. So this is a pictorial representation of the cross section of skin in young and elderly. If you see in the young, all the layers are tight and taut, but good dermal papillae, a good network of blood vessels, and the crisscross, a white thing that they signify collagen and the adipose tissue. Whereas in the elderly, the sagging is denoted as undulation of the epidermis, that is in a wavy pattern. And when you come down, the vascularity is also come down and the collagen is also disappeared. All of these procedures earlier, especially RF, helps in tightening of the muscles and rebuilding the collagen again. So it usually works on a principle of one, the single tube cylinder with the connection talks about monopolar. The other bipolar handpiece where the delivery electrode emits and again a return electric takes back the energy. So there is minimal thermal damage and it is more of a focused energy delivery. So RF usually is more diffuse. So it is a modification used in even in derma pens or HIFU, high intensity ultrasound radiotherapy, or even in radio frequency derma rollers. So all of these use radio frequency technologies. So here the photograph shows a microneedle cartridge when it is placed on the skin surface, how it sits and when it penetrates into the skin, just the needle on the second one. And when RF energy is introduced, the amount of damage or the accuracy which it shows. And in the last photograph, the same thing causing collagen regeneration and new elastic production process begins. That's how radio frequency technology holds the upper hand over the other modalities. So this is how the pen is held on the skin surface and a continuous energy is given. The first photograph talks about RF technology with sterile needles. The second one is more of focused ultrasound therapy using radio frequency. So a slight modification to this is also called transdermal drug delivery system, where radio frequency technology is used to deliver drugs to the undersurface. So in terms of electrophoresis or magnetophoresis, iontophoresis, thermophoresis, these are quite commonly used in case of hyperhidrosis, where there is excessive sweating and then you need a drug to be delivered. So these technologies can be used. At the same time, the jet injector is a latest method used to, or commonly known as painless injection, where a jet delivery system enables the delivery of the medication to the target organs. In summary, so acne scars, pigmentation, aging, and alopecia are common cosmetic problems presenting to the dermatologist. A thorough clinical evaluation is needed, appropriate counseling, combination of multiple procedures is often required to fulfill patients' expectation. The trend in cosmetic dermatology is towards minimally invasive procedures such as chemical peels, injection of botulinum toxin, fillers, and platelet-rich plasma therapy. Common lasers in dermatological practice include diode lasers for hair reduction, pulse dye lasers for vascular lesions, CO2 lasers for scar resurfacing and ablation, Q-switch NDR lasers for pigmentary lesions. Aesthetic procedures in trained hands with suitable expertise have minimal complications. However, care should be exercised to perform these procedures ethically and judicially. Thank you.
Thank you, Uday ji. So meanwhile, there is one more session, short session. We have designed this session to equip you with the practical strategies to build credibility, strengthen your brand, and attract high quality clients. You're ready to grow, whether it's improving patient care, building confidence, landing better opportunities, or enhancing your personal brand. So Ankush is here who will guide you and tell you. Over to you, Mr. Ankush. Mr. Ankush, can you please unmute yourself?
Yes.
Yeah, sure. Thank you.
Hello. Hi, ma'am. Could
Hi.
you provide me the access to the camera?
Sure. Vijay, just give me a moment.
Sure.
Ankush Arora, right?
Yes.
Yes. Can you please start the video now?
Yes. Works perfect.
Thank you.
Great. Thank you so much, ma'am.
My pleasure.
And hello, everyone. Hope everybody is having a great time and has had, a tremendous session right now regarding the whole, your journey around the doctorate and the knowledge base. So we want to like slightly introduce about what we are doing here and why we are present here today. So let me formally introduce myself. My name is Ankush, and I'm here on behalf of Xly, which is an automation platform that's been, helping a lot of people, coaches, trainers, doctors, and other professionals from different, niches as well. And we help people, build their own automation systems so that they can take their business online, set up their own scaling practices, and further grow their practice. So first of all, hi everyone, we are really happy, would love to know a little more about you. So all the doctors that are present here, if you could use the chat, could tell us a little about yourself, that what do you currently do? Are you practicing? Are you running your own clinics? Are you trying to expand your practice as well? If you could just use the chat, let us know a little about you.
Yeah, most of them are like having clinics and working in the hospitals, and some are working individuals,
Right.
as well as they own their own setup. Like some are like freelancers.
Right.
It's a mixed audience we have.
Great, great,
Some are
great.
yet to graduate, some are already graduate in the mode of graduating. Like that.
Got it, got it. Perfect. So we actually wanted to, give a very little brief journey. Like today's session is going to be a little around, about how, there are a lot of dermats, there are a lot of doctors that are using some online systems and presently building a practice for themselves. So we're going to keep the session very brief. We're going to talk about further, certain things that are going to be an important strategy, how, the practice can be boosted and, taken up online as well. So I'll be starting with the session today and presenting my screen. Ma'am, if you'll allow me to present the screen as well.
Sure, definitely.
Yes,
Just give me a moment.
sure.
Vijay,
Yes, yes,
can you please allow him to share the screen, Vijay?
yes, yes. Sure.
Sure, thank you. Meanwhile, I'll just take a moment, Mr. Ankush.
Sure.
Hey all, actually we'll have the Q&A session, which is more interesting part after this 20 minutes. It would be a session till 7:20. After that, we'll be having a Q&A session. Meanwhile, you can type your questions and keep it. Once we ask, you can start shooting the questions. Thank you.
Perfect. So essentially for all the doctors that are present here, does anybody practices their business online? Have you started to, expand your business online or set up anything for yourself now? Anybody who's sort of looked at the marketing aspects of the business, maybe increasing their client flow or their patient flow, increasing more inquiries coming into their clinics as well. Has anybody tried anything around this? We have one no, we have two no's. What about the rest of the people? Great. So majorly, what we are going to cover here today is a lot of times, we have the major aspect that whenever we are trying to set up our practice, whenever we are trying to scale up business as a doctor, as a health professional, a lot of times we are very much reliant on the regular or medieval ways of marketing. Either it's going to be marketing or the referrals or the one-to-ones that we're going to get, right? So we have one person who said who hasn't tried an online platform. So yes, moving to that aspect, majorly what we're going to focus here is how to boost your practice with some certain online strategies and an automation system as well. So when we talk about any new patient coming in, I'm sorry, I just
मेरा
Sorry,
पैर है
can you please give me a moment, Mr. Ankush. I would request the participants to mute themselves and do not. Thank you. I think it's mute now. You can go ahead.
So majorly when we talk about any new patient flow, like majorly as a doctor, when you're experiencing a new business, when you're, looking to grow your practice, majorly it's one-to-one referrals that come to you that, bring in a new patient, somebody, who's had a very good experience with you. They refer somebody as a friend, as a family, and usually you get to have your own, set of new people coming in or new, patients coming in. Similarly, if you're currently working at a hospital and managing your own practice, so references that come through hospital or people, who make inquiries, who get to know about you, these are the sort of people that come to you. Similarly, there is one inorganic flow of any new patient inquiry that's going to come to you. That's going to be either through marketing, through flyers, or through ads. So anybody here also knows any other way wherein a new patient can come to you, or any new source from where a patient can come to you? Anything that you would like to add over here? Like feel free if you've had or figured out a new method that's going to help you, build something for yourself, or any new flow that's going to help you understand how you can market your clinic better, how you can increase the number of patients coming into your clinic or your practice as well. Anybody who would love to share about their experience, you can use the chat for the same.
Can you repeat your question once again?
So, my question is like, majorly, we believe like these are the two sort of, marketing ways where, doctors usually get their new patients. Like for
Yeah.
anybody who's been in the market, either they get it through referrals, somebody tells a friend or a family, somebody gets their references through the hospitals. And there is one method wherein we talk about flyers, marketing, ads. But, anybody who knows how new patients come in or any new inquiries come in, because if we talk about, with this light example, when I say inorganic marketing, we don't see a lot of flyers that are being sent out by doctors, because doctors usually don't market themselves that way, or there are no ads coming up for doctors or any particular clinic that is around my area.
Sorry to hold you. There is one message in chat box from Dr. Zubair Khan. It is by doing free camps.
Perfect. I think that is one answer we have, and definitely, that's one way, because doctors using WhatsApp and email to existing decline data. Yes, perfect. Teleconsultation. Yes, exactly. So as you see, like whatever things you're suggesting me, like teleconsultation, camps, and these methods. So whatever value a doctor provides in the market is associated with a knowledge base. Like give something in terms of knowledge. You don't want to just market yourself. You want to give something in return. Either it could be a teleconsultation that you give for free. That way, the patient comes into your clinic. If you give some sort of free camp, that is where people come in, get themselves checked, and eventually, some people purchase your services. So that is exactly the method that has been working for a lot of patients, to come in into your clinic. And that is what we're going to talk about, how it exactly works. But the major aspect is when we talk about the first system where you're waiting for referrals, we're waiting for friends and family, you're waiting for references through the hospital. This is something that's out of control for you. You cannot increase the number of patients coming to you. And that is where a lot of doctors get stuck. That if they want more number of people coming in, how they can showcase the value and have more number of people inquire in, right? So one of my patients came with his products as gift for after his wife delivery for the staffs. Nice. So similarly, we are going to talk about the aspect that what is the sort of knowledge driven or, the market out there for a lot of doctors, the way they're presenting themselves. So this is where, the first aspect comes in. And second, the major aspect that why marketing is a more accountable version, because if you put out yourself, if you put out your own brand outside, you can start having more number of patients that are going to come in. So this way, if you're not relying on just referrals, you're marketing yourself better, you're able to build your own brand. The better brand that you build is the better retention you will have of your patients. the more you market yourself is where you're going to have more number of patients come to you. And the better you market yourself is where you're going to have the better quality of high paying patients as well. So majorly, when I talk about a lot of dermatologists that are existing in the market, their quality of service is something that's more, not a generic content, but something that's going to be high paying or a, high paying field as well. Whatever sort of patients you are looking at, you would want them to be retained because the products and the services that you're going to offer are eventually also going to be more pricier than regular doctors. How many people agree that, when you got into the field of dermat, you understand the value you're driving, the sort of expertise it takes, and the sort of money and the charges you're going to take? Do you all agree that your patients have to be a little high paying capacity patients, a little higher power of patients as well? How many people feel this way? Like, dermatologists do have a different set of patients as well that are going to come in. You can feel free to write in the chat, and whatever suggestions, whatever, feedbacks you'll have while the session, we will be talking about that. So majorly, when we talk about the better quality or the better marketing of your business, we come to the major aspect that how people are actually, getting the patients, or what are the major marketing strategies where new patient inquiries usually flow in for doctors. So how do new patients look out for you? They either come across your profile because they have some similar interest to, what they're looking at, or they come, through Google, wherein they probably put in that, the nearest dermat to be the nearest, specific doctor to me that I'm looking for, or whatever problem they're looking for, and a doctor for that. So majorly, this is how people have been, looking out for people online. This is how people have been looking out for doctors online. And social media sort of has become, the latest marketing place for everyone. And even where doctors are driving everything through the knowledge base. So when I say similar interest, a lot of people must have noticed there are dermatologists, there are doctors online that have their social media in place where they're giving some value content, they're teaching some certain, aspects, and they're telling about some good practices, they're telling about some good wellness practices, some good skincare practices as well. And that is, helping drive them that brand value in the market, and they're able to, have more number of people come in as well. The other way is the major process when anybody wants to look for a dermat, they're going to type in the nearest dermat to me, and they're going to search on Google for you. And both these aspects of searching, both these aspects of finding somebody are going to yield a similar sort of result. That is going to be either somebody looks for Google and they come across doctors where they can directly give them a call, visit their website, see their preview, see their pictures, or they're going to come across different websites wherein these services are being offered. Now, do you notice, like, out of majorly all the brands or the listed brands over here, a lot of them are bigger brands. Like 1mg is one big brand. Then there's Skincare Gurgaon, there's Skin Zest, all these different people, different doctors, different hospitals providing these services. So for them to be listed higher on the Google, for them to be being able to searched like this on a website or a website platform like this, they're putting in the effort because they have understood that even for doctors right now, there is a certain set of marketing practice that is happening. Their profiles come up, their websites come up, people come and look for the credibility. So this is where the major impact comes up as well. Similarly, if I see any profile that's coming up on Instagram, so, you must have noticed these accounts. Like there is Dr. Garekar. If I searched for skin clinic, I was able to see her profile or her website coming up on the top as well. When I look for Dr. Rashmi Shetty, her dermatologist and profiles also come up over here. Then there's Dr. Ankur Sareen, there's Dr. Aparajita Lamba. All these people, what they're doing is they're building their brand as a doctor online as well. So how many people must have noticed their social media? How many people must have come across their profile? We have some people who are saying, yes, exercise your brand on social media. That's exactly what we are talking about. How many people have created a profile like this or are planning to create a profile like this where you can build your own skin brand as well, where you can personally put yourself out as a doctor as well? You can put in the chat if you have your Instagram in place. If you have a social media link in place, you can put that. So majorly, Google and social media have become the newest marketplaces for all the doctors as well. And what you can notice over here is that every doctor has a link that they have given over here in their profile itself. There's a link over here, there's a link over here. Then similarly, if I go to Google, there are websites as well. So majorly, what are these links as a common about? These links are the system that they are using to, probably build their brand, probably take up their teleconsultations or online one-to-one consultations, like you mentioned, or probably awareness camps, free camps, or the products that they have created to gather the leads. So when anybody is, creating their marketing aspect, when anybody is putting in, their business in front of other people, they want to give some certain links from which they can start collecting the data of their patients. They can start collecting the leads of their patients as well. So exactly the sort of system that is going to be required is usually a website that's interactive, that's built in this way that you can collect or take up appointments for the same. And similarly, when I talk about certain websites like this is what doctors need to ideally build. And, there are a lot of big brands, there are a lot of big, online brands in terms of doctorate, in terms of, franchisees that are working in this similar manner where they have their set up their systems online and they are, generating patient inquiries, they're getting leads, they're getting appointments, all done through social media, all done through, the internet as well. But when it comes to individual doctors, they usually get stuck in building their own system or expanding their practice online. Reason being, a lot of times, thinking about getting your own website done, getting your own online system done is a high cost setup for you. A lot of times we don't have the right tech awareness that, how a system like this is going to help me, how a system like this is going to help me expand my business as well, or how it's going to help me generate more leads or patient inquiries. Then I'm sure, like, as a doctor, you must also have your payment hassles. Like right now, if you're running a clinic, or in case you give a teleconsultation, you cannot collect payment online. If you want to collect a payment online, it's usually Google Pay or, a screenshot that needs to be shared. That is a manual process, tedious process that somebody has to manage. Similarly, manual mayhem, where you want to track your inquiries, where you want to have the data of your patients that have come across. Because if you want to retain somebody, you need to keep in touch with them. You need to nurture your patients. You need to send out different offers as well so that those patients come back to you, or usually the tech support a lot of times. So, how many doctors here who are sitting here who are already running their business or running their practice have tried to scale their practice online as well? How many have you come across any of these challenges? You can just put in a yes in the chat if you've come across any certain challenge like that, because we'd love to know how we can, help you out, how we can customize the experience for you. And we're going to tell you a very simple solution that's going to help you manage your business online as well. You can put in a yes if you've encountered any such technical challenge while setting up your clinic, while setting up your practice, online or offline. Yes, somebody's marking the technical support and the manual mayhem. What about the rest of the people? Yes. So majorly, a lot of doctors face this challenge itself, like when they're talking about, the costings, awareness, payment hassles, manual mayhems, tech support as well when they want to set up the system online. But there is, certainly some things that stop them and, some things that stop them from getting to the right approach. So here, usually what the problem or, what the challenge comes is there are multiple parts of an online system. When I say multiple parts of an online system, the first important aspect is the website. So when you want to build a website for yourself, you want the website to be mobile responsive, you want to have a fast loading time, you want it to be visually appealing and attractive as well. You want it to review or display the patient reviews, both text and video portfolios that can be done. You would want to have some CTAs in place as well so that whatever number of people are coming and visiting your website, they're able to see what you offer as a service, what credibility you build in the market, and along with that what sort of ways they can reach out to you, they can book a call with you. So your website should also entail multiple things. When I say, if you want to take up one-to-one consultations or teleconsultations online like this, you would want require a appointment setter or a scheduling tool in place. You would require WhatsApp email automations that are built in with the system as well. You would require reminders that go to your students, go to your patients as well. So that's going to be an essential aspect of things. Then payment collection online is another hassle, but that should be solved for as well. In case you are running your camps, and after that you want to sell your packages, you want to give your offers, you want people to make the bookings for the same, you would require certainly some packages or marketing tools that are going to help you create that. You're going to require payment gateways, broadcasting, or bulk messaging tools as well, that are going to help you market yourself better to the existing patients. So how does that sound? Like, do you think these are certainly some essential aspects of a website? Certainly this is a part of your system that you should have. Right. So, majorly when I say, when anybody wants to, set up their doctorate practice online, they want to sell merchandise as well. So these systems, these, websites become an essential, aspect of the same. Then payment gateways become another essential aspect for the same, wherein you can, collect your payments, both domestic, international. You would want a CRM to capture the data of your customers. That's going to be essential as well. So this is one another tool that's going to be very super essential for all the doctors when they're setting up their online business, or when they're using the online approach so that they can set up their business online as well. Then further you have further tools wherein you can set up an entire system over here. Like this is an example of a CRM system. So what are the number of patients that have made the inquiries with you? What are the purchases they have done with you? When was the last time they had an appointment fixed with you? What sort of services and programs they're taking with you? Then similarly, any sort of further requirements they'll have. When was the last time they booked a consultation or booked a call with you? Any sort of notes that you would want to add to this customer or this patient, that can be done. So all in all, there are certain systems, certain automations, everything that is going to be a part and parcel of your system. When you're setting up your system online, automation and sales, email marketing, these become like an essential tool as well. So having your system in place as a WhatsApp and email marketing system or sales page that you can create, all these things are, the major marketing tools that are there in the market. So what we want to get over here, or what we want to show over here, is we at Exley have been working on one aspect, that we have been working and helping a lot of doctors set up their entire systems online, so that they can do their marketing, they can have their own website, they can have own systems in place. That is going to help them capture and build a system like this. That's going to be the essential for you when you are out in the market, when you're looking to expand, when you're looking to scale as well. And how do these systems help, and what sort of costing and savings that come across with this? So to give you an idea, like individually a website like this costs you around 30,000 rupees. There are different offerings that you want to put out there, your one-to-one consultations, your payment collection and CRM tools that you would want to buy, your automation and email marketing tools that you would want to buy. All these things become like a super essential for you. But in this case, why Mediversal, brought us together here, or why Mediversal, gave us the chance to speak to all of you, is because Exley is an all-in-one automation platform that has been working with multiple professionals from different niches, wherein you can set up your own website, you can have your own landing pages, you can run your Facebook and social media ads through our system. You have scheduling tools that are already in place that help you fix up one-to-one consultations, help you take up virtual meetings. Our systems come integrated with the Zoom accounts, with payment gateways already as a part of the system, and WhatsApp email marketing tools that are going to help you expand your business online. So, majorly, like the systems that are required for your online practice, the system and tools that are going to be required to conduct the business online, to expand the business online, is where essentially we come into picture. We help you build that tech for yourself and make it easy for you as well. So similarly, talking about a brand called Ziva that has been working with us by Dr. Anjal Shah. She's been using our platform. She's set up multiple things over here. She's been selling her merchandises. She's been using our platform, or the setup that we have done for her, for setting and selling her premium hair care products, maintaining that sort of SEO around her website, running their own ads, collecting all the leads and customer information over here. They also offer their one-to-one consultations, both online and offline, that are managed by our system for their automated scheduling. They have, different procedures, packages, and services that they also sell through, a single platform as well. Then going forward, we have, different core features that she's been using for running her ads, sending out limited time offers, sending out the lead data, and, collecting the leads, and nurturing them for running out the offers as well. So this is where, a lot of things also help in terms of, setting up their systems. Then going forward, when I talk about further, the requirements, what has been the contribution of growth, for Dr. Anshul Shah? She's been, create urgency to, different customers. She's created high ticket programs and services wherein they have collected a lot of payments through the online systems. They are able to improve their SEO to bring their website and their products in a, higher or a superior practice as well. They've maximized the lead capturing system. So a lot of times when we're running our business online, we do need to capture the customer data or the patient data. So they've been using our CRM as well to capture all this data and manage these leads efficiently. Then there is another doctor, Dr. Atul Chaudhary, who's been, focusing on online consultations and offline visits for their hospital, and they've been, investing this marketing time to, grow the practice of their clinic. So actually, helps in payment collection, sending out the reminders, WhatsApp and email reminders that are sent from the system, feedbacks and testimonials that are collected for their, pages as well. That can be done as an automated practice. So this helps Dr. Atul, majorly spare time so that he can focus on his practice and automate the rest of the tasks as well. So today, we see a lot of doctors who are here as a potential space where they are looking to grow themselves. You guys are already, taking up all the knowledge-based sessions from Mediversal and learning everything around that. So we have an express interest from anybody who's looking to expand their business online, looking to automate the patient flow for your clinics, for your practice as well, or looking at various marketing strategies that's going to help your clinic grow, your doctorate practice grow. You can scan this QR code and fill out the form as well that we have shared in the chat. You can have an access to this. All it takes is your name, email, and phone number, and we'll have an expert give you a call, talk about your current practice, how you're running your practice online right now. If not even online, you're doing it just online. What are the new things that you can implement in your system that are going to help you in terms of expansion for the same? So you can fill out this form. It's a very easy form where you need to fill up your name, email, and name, phone number, anything you would like to share about yourself and how you would want to rate our today's session. You can fill up the information and we'll reach out to you to help you with the next steps.
Uh, Everyone kindly fill out the form and get the details, put the details and submit the form for the further steps. So like Ayush Srivastava has dropped a link in the chat box too.
Right.
Kindly go to the link and submit your details. So also there is a QR code which is displayed on the screen. If you want to fill the form right now, you can scan the QR code from your camera and then fill out the form.
It's majorly interesting for everyone if you're looking to scale your practice, you want to set up your own system as an online system that can bring you new patients, that can help you in advertising and marketing. This is going to be the right approach for you, and we're going to help you with the strategies around that and help you understand how these things can be done. How do we help other doctors already who are working in the similar niche as well? Everybody can fill out the form. In case you have any queries, anything you want to ask, you can just drop in the chat as well.
Exactly. And also if anybody is interested in digital marketing or online services, like for related to business improvement and new techniques, kindly please scan the QR code and submit your forms. Mainly about the digital marketing. And the certificate link will be dropped in the chat box after the Q&A session. And also, I'll be also dropping the same link in our WhatsApp group, which we have, which will be posting all the things in the group, Mediversal community group. Like there will be also posting the same link. So kindly fill out the form, like if you're interested in digital marketing and all. So kindly fill the form and submit. They'll get in touch with you soon. Thank you, Ankush Arora, Mr. Ankush Arora. I've already dropped the link in the WhatsApp groups. Like who all are interested, they'll get in touch with you people. So
Yeah.
thanks so much. It was an amazing session which you have taken through. Thanks.
Yes.
We'll be continuing with the Q&A session. Thanks a lot.
Right.
Yeah, sure.
Thank
Dear all, kindly please drop your questions in the chat box. We'll do the best to answer them. I think we already have few questions. So guys, stay calm. We'll be posting the certificate link as soon as possible once the Q&A session ends. There is a question from Dr. Afijur Rahman. Ultimate guide, Hydra facial and diamond glow treatments. Just a moment, just a moment. I'm doing it, I'm doing it. Can you please unmute now? Sure.
Yeah.
I'm so sorry.
Yeah.
Sorry for
Just to answer to that, see, dermabrasion, microdermabrasion, and hydrofacial, they're pretty much the same, but work on different platform. Here we use aluminum oxide crystals, like I said earlier, and diamond tip. Whereas in hydrofacial, there are chemicals that are used, and both are more of a instant glow therapy, which can be done on need basis. Let's say you'll have some parties or a function to attend to or an occasion, then you can do. So the microdermabrasion is more cost effective, whereas hydrofacial is a little expensive.
Thank you, Udayji. A very practical based session. Thank you, sir. Thank you, thank you,
Thank you.
doctor. So we'll wait for some time, like if there is any questions. So I'm just waiting. I'm not sure about this, but I have a question. I'll read it out. There's a question from Mohammed Legally Cole. I am sports therapist and massage therapy teacher in the Gambia. Please, could you explain the causes of goosebumps and how you treat it?
See, goosebumps, do not see it as a problem. This is something that happens to all of us. So there is this muscle called erector pili, which is associated with the hair. These muscles are associated with parasympathetic activity in the body, meaning which react according to emotions. Now, let's say there is fear, there is danger, there is anger. So then they try to arise. So otherwise, this is not a problem per se. This is body's way of acting. These are involuntary muscles which perform or react according to based on one's emotions or circumstances.
Thank you, Uday, for the answer. So I'm just checking for the further questions. Kindly please subscribe our WhatsApp channel, and meanwhile, please do follow our social media platforms. Deji, we have some questions from our in-house team, like where we have our students group. Our students have dropped some questions. One is, how do derma fillers work, and what are the key areas where they are most effective?
I think I've already elaborately spoken about it in the presentation itself. So it is mainly for volume, wherever there's volume loss, in such conditions you give. Now, let's say there's temple hollowness or there are tear trough, that is sunken eye drop, and there's no loss of volume in the cheeks, or for definition of the nose, or even for definition of the nose that you give. And it is basically filling agents, which I've already mentioned in the presentation, that are used to give the contour. These agents are short-lived. So based on the brands, they work anywhere between close to 1.5 years to 2.5 years.
Thank you, Uday. So there's one more question. What are the key factors to consider when assessing a patient for aesthetic procedures?
Okay, I think people are reshooting things which I've already spoken about. I've mentioned this also. So this requires one to assess patient's demography, right? So you're supposed to understand the patient's skin type, the gender, the skin color, the place they come from, because even sun and sun rays also play a quite important role. Also, medical history, including keloid and herpes, because your procedure shouldn't trigger. So a detailed information about this will give you a fair idea of to what procedure to assess or tell whom.
Okay, thank you. These were the two questions I had in my WhatsApp group, internal WhatsApp group, a group of candidates. So can we wait for under 5 minutes or 5 minutes for any questions? Kindly please drop your questions in the chat box. We'll do the best to answer them. Additionally, we have also dropped a link in the chat box for your participation certificate. Please do fill out and submit the forms to get your participation certificates. There is a question from Dr. Deepak. Sometimes we use skincare products from other countries. Does that affect or have different reactions in other regions?
Definitely, yes. So each skin types are different. So our genetics do affect on the skincare products. So when you use something very basic like a moisturizer or sunscreen, they're safe. So they are pretty much same to all the skin types. But when you're using any skin lightening agent, you definitely have to follow protocols. As in, their skins are more fairer than ours. So you do not know how they react on your skin. So stick to something which is more native or consult a dermatologist and then seek guidance and start.
Thank you so much, Udayji. Like American product nation, it is same. Whichever the country it is,
Correct.
the product are completely
Yes,
different.
because genetic needs do vary from region to region.
Yes, exactly. Thank you. So let me wait for 2 minutes. Kindly please fill your certificate form, which we have already dropped in the chat box to get your participation certificates. Thank Sure. I think there are no more questions, I guess, because we have waited. Yeah, there is one more questions. There are two questions. The question is from Dr. Uzair Ahmed Barodwala. Looking very energetic at the end of the day, what the reason formula behind it? I think no.
I think there's no reason. I think love what you do. I believe there are interesting people waiting out that side for some quality information. I think that is what keeps me going. There's no other thing. The
Yeah,
credit to the listeners. That's all.
great. We have done so many sessions with Udayji. In each and every session, he'll be the same energetic
Thank you.
person.
Thank you. Thank you.
Thank you. It's our pleasure. There's one more question from iPhone. Sir, in my both side cheek as pimple black pigmentation mark, is there, and I had been used so many products for hyperpigmentation, but not reduces. What should I do now? I think it's out of the.
Okay. The one answer to that person: stop asking anybody and everybody for advices. The reason I say this is different people have different opinion. every skincare routine is tailor-made. It's best you consult a doctor in person for the best results.
So you generally, if we go to if we go for a problems of cardiology to dermatology, it is very different, right? So mean,
Correct.
if you go and ask the normal people, like in the sense your colleagues or friends, they might be not knowing, they might be
Correct.
referred by a doctor, but their skin tone is different and your skin tone would be completely different.
Very
So
true.
stop getting suggestion from your friends and all. So kindly go to your dermatologist. Or is
I think I
Dr.
see another question. Yes, yeah.
Yes,
So is daily use of salicylic acid face wash safe? See, again, this depends on the skin type. Salicylic acid is targeted at somebody who's got an oily skin. If if you have, then yes, go ahead. If not, then refrain from using it.
yes. There are so many things, like very nice, knowledgeable lecture. Thank you, sir. Um, and thank you so very much informative sessions. Thank you, ma'am, for this amazing session. Please thank Udayji.
Both ways. Thank you.
Thank you. So, can BDS practice aesthetic?
This is a word of debate. I think, see, being very open on an open platform, coming from dermatologists, specific needs are meant for specific subjects. So this is always a what to go with. I leave it for your discretion. From my end, a degree is required to practice it. That's all I'd say. So specific degree, practice specific needs.
Sure. Thank you. How long we use finasteride tab?
There's no specific duration. Again, this is out of topic, but based on individual's need. So let's say the patient responds well, then you give him for a period of 6 months and then slowly taper it off, or 6 months and increase your dosage of minoxidil topical solution.
Yes, I think thank you, Daichi. So there were many questions you have answered. Thank you so much for an informative and knowledgeable session. Uh, Thank you all for joining us today. We hope you found this webinar informative and valuable. If you have any further questions or would like more information, please feel free to reach out to us. We have Instagram channel. You can drop your question in our Instagram channel, where we can answer your all questions. Additionally, I have already dropped the link in the chat box for you to fill out and submit to receive your certificates of participation. If you don't fill the form, you'll be not receiving the participation certificates, kindly fill it. Don't forget to follow us on social media for updates on future webinars and events. Have a great evening.
Thank you.
Thank
Thank
you.
you. Thank you.
You can leave, Udayji. Vijay?
Yes, Gagana. I am ending the meeting.
Sure.
Thank you.
Thank
Thank you. Thank you. Thank you, Gagana.
you.
Thank you all.